Hospitals across India have been reporting several cases of mucormycosis, a rare fungal infection affecting patients who have recently recovered from COVID-19. This mucormycosis or black fungus is an aggressive and invasive fungal infection caused by a group of molds called mucormycetes. People are getting several news reports and informations from different sources, and also we may have different doubts. So today I am opening a platform for my students to ask some questions and clearing their doubts. So now students are in line. So I think now Jashan is on call. Let's see what is her question. Yes, Jashan.
Hi sir, there are many news reports about black fungus, but still people are not having any ideas about this new disease.
Yeah.
So my question is, could you please tell us briefly about what is black fungus?
Yeah, good. The question asked by Jashan is a good question. So many people may have the same question about what is actually black fungus. Okay, listen. Mucormycosis or black fungus is an infection caused by a group of molds called mucormycetes. So these molds are present in the environment. The infection can occur after someone breathes in spores. So this mucormycosis mainly affects people who are immunocompromised or take medicine that lower the body's ability to fight germs and sickness. It can affect various organs, but it is currently manifesting as an invasive rhino-orbitocerebral disease affecting the ear, nose, throat and mouth. It is not contagious but can cause a lot of damage internally and can be fatal if not detected early. The common name black fungus is in reference to the blackening that is characteristic of the disease. So one can suffer from this disease due to exposure to fungal spores in the air. Due to not being cautious at the right time, these fungus spores can go inside the body and damage the lungs. So this is a common question that Jashan was asking that I hope it will be helpful for many. Okay, let us see what is the next question.
Hi sir, every sickness has its own symptoms on the body, sometimes without symptoms also. So my question is, what are the common symptoms of black fungus infection?
Yeah, there are some common symptoms. Especially black fungus symptoms mainly show some common symptoms including excessive running nose. You may feel swelling and pain in your eyes when you come in contact with the infection. In some black fungal infection, eyelid loss and blurred vision have also been seen. Dark spots can also be seen around the nose of the infected patient. Some patients have also spoken about their eyesight being completely gone. So now doctors say that patients come to the hospital late considering these symptoms as normal. Due to the spread of eye infection, the eyes of some patients also had to be removed by surgery because the infection could spread to the brain through the eye. In some cases, both the eyes of the patients had to be removed and jaws of some of the more infected patients also had to be removed. It is mainly seen in black fungal infection post-COVID patients. So these are the main symptoms that we can see in black fungus infected person, and the consequences also I have said briefly here. So let us see a next question. Yeah, it is Suneh Preet with us. So let us see what is her question.
Sir, there are causes behind every sickness. We are getting different informations about the causes of black fungus. So could you please tell me about black fungus infection causes?
Yeah, Suneh asked a good question. The causes of black fungal infection. So anyway, black fungus is present almost everywhere in our common life. So it is usually produced automatically on rotting soil, plants, manure and fruits and vegetables. So this infection is ubiquitous as it can be seen commonly in black fungus air and soil. This infection has also been confirmed in the mucus of a healthy person. So generally patients who are prone to black fungus infection are those who have recently got rid of the coronavirus. You can get hold of it due to any common thing like soil and contracted air. This infection is seen more in patients with the cancer or HIV patients. Most of the patients are aged around 35 years of age in the normal age group. So it is a threatening news that if a person had already affected by corona will be or may be the next victim of black fungus infection. So I hope the answer is clear for you.
Hello sir, there is saying that prevention is better than cure. So what do you? Please tell us about black fungus disease prevention steps.
Okay. The question was the prevention steps of black fungus. So usually nowadays people are wearing mask and sometimes we may use twice or thrice the same mask after going somewhere. Make sure that mask should be disinfected or washed daily. Those who are taking steroids should be keep checking their blood sugar levels. I can give three important factors here. First one, good control of blood sugar levels. Secondly, those on steroids must monitor blood sugar levels regularly. And third one, be careful about when to give steroids and their dosage. Here I would like to give some more easy steps to follow. Stay indoors as much as possible, regular exercises, control of blood sugars. At home, the surroundings must be clean and free from dust and dampness. Maintain oral and nasal hygiene. While going out, always wear an N95 mask. Avoid construction areas, fields, grounds. And as I said before, soil and plants are the areas that abound with fungi. Hence, better to avoid working with the soil or gardening. If unavoidable, mask, rubber gloves and boots are must. So if you are following these steps, somehow we can prevent getting this black fungus. Okay, I hope the answers were very clear and easy for you to understand. And let us see what is the next question. Dupinder is in line. So let us see what is the question.
Joshua sir, thanks for giving a chance to clear our doubt with you. Sir, my question is, what are the clinical features of mucormycosis infection? How do we diagnose them?
If I am right, Dupinder was asking a question. What are the clinical features of mucormycosis infection? How do we diagnose them? So according to me, it is a very important question in this section. Nasal blockage, bleeding, discharge from the nose are initial features of mucormycosis. On endoscopic visualization of the nasal cavity, an unmistakable black scar, coated masses will be present, which gives away the diagnosis. As the disease progresses, the palate may be destroyed as a large black necrotic mass may be seen on opening the mouth. When the orbit is involved, there will be proptosis, loss of movements of the eyeball with the consequent double vision. Eye pain, redness with blindness can follow. If the brain is invaded due to blood vessel blockage, there will be strokes, hemorrhages, and even death. Patients can also have headaches, drowsiness, limb weakness, seizures, and even death. Now, according to the second part of the question, based on clinical suspicion, MRI and CT scan of the nasal cavity, sinuses, and brain is performed. These give a clear picture of the presence of the lesion along with its extent. In lung mucormycosis, clinical features are similar to COVID-19 with fever, cough, shortness of breath, making clinical diagnosis difficult. Suspicion of the fungal infection must be considered when a patient, despite getting appropriate medications, is not improving or was improving and has unexplained deterioration. CT chest helps in diagnosis by revealing additional lung lesions. So I hope you have understood, and most of the questions we have already covered. And now we have Christina is in line, and let us see what is the next question.
Sir, commonly we can identify the sickness by seeing the symptoms in the body. So, could you please tell us about black fungus symptoms?
Yeah, the question which Christina was asking is an important question, and some of the symptoms or points I have already shared. So it will be good if we know about the symptoms, so that we will understand how serious is this issue. So let me say 2-3 points of the symptoms, so easily we can identify if a person has infected by black fungus. Some of the common symptoms that we can keep in mind. The symptoms of black fungus or mucormycosis are pain or stuffiness in the nose, inflammation on cheeks, fungus patch inside the mouth, and swelling in the eyelids. It is better to not fear when we see some symptoms, but it is better if you consult a doctor as soon as possible. So we are going to conclude this section. We have a last call, that is from Arshia. Let us see what is the last question.
Hi sir, there are many true and fake news regarding black fungus. Recently we got an information that steam breathing can be a main cause of black fungus, and also the black particles from the mucus when we sneeze also can be a sign of black fungus infection. So could you please tell us whether the information are true or false?
Yeah, that is true. There are a lot of fake news, fake informations are coming up every day, even in social medias. So before talking about the two informations which are shared here, let me say something which I already said about black fungus. So mucormycosis or black fungus can mainly affect the person who is immunocompromised, because their WBCs will be very less. This fungus, the molds are everywhere in the atmosphere. So it usually goes in when we breathe, but our white blood cells are destroying them and we are not getting any issue with that. So we have to know one thing: this mucormycosis or black fungus mainly affects the person who is immunocompromised, a person who is having steroid types of medicines, because their WBCs will be less, the white blood cells will be less. It will be very difficult for them, as the fungus can easily go in and start splitting or multiplying. And also we know people used to have medicine without consulting a doctor, without having a proper prescription from the doctor. So these kinds of people may have some problem with their immunity, so it can easily spread. So by keeping these things in mind, let me do the two important informations that Arshia mentioned here. These two informations are fake, because people are thinking that when we breathe steam, our nose will be wet so that fungus can easily grow. The second information about the black particles which is coming with the mucus. A person with infection or with some sickness, small blood vessels from inside the nose may break and drops of blood may come out. It will stay there and clot. Later, when they sneeze, the small particles from this clotted blood may come with the mucus. It is not black fungus. So it is better to not fear about the news or informations which we are getting from different people, but it is better to be safe and consult a doctor when we feel some sickness. Hi everyone, today we had a wonderful time, and I appreciate the students, those who were asking the questions, and I hope these informations will be useful for you. So be safe wherever you are. Always keep in mind, prevention is better than cure.